definitions up. Type 1 diabetes. So typically we discover type 1 diabetes around ages 7 to 12. There is a familial tendency toward diabetes type 1. And in those families, they tend to know to look out for a potential problem during these years, but a lot of the times it's new. And what happens patho-wise, the autoimmune system destroys the pancreas and the islet cells. Or it's pancreatitis and it destroys the islet cells, or it's a pancreatic cancer and we had to remove the pancreas, or it's cystic fibrosis and this client has an increased risk for type 1 diabetes because cystic fibrosis can cause scarring in the pancreas, the pancreatic ducts, and therefore causes problems and can lead to a secondary type 1 diabetes. All right. But more often than not, it's an autoimmune problem. This is what is important to understand. So when these kids are discovered, they typically are going into a DKA, and that's when we first meet them and first diagnose a new diagnosis, type 1 diabetes. They went into a DKA, which is why it's one of the most tested. Because when you're dealing with emergency situations and stabilization, again, my job here is to tell you how to stabilize, how to recognize a child that's unstable, how to stabilize, and how to send them to the right place. So in DKA, ABCs are first because they can easily go into a coma. So when you're looking at questions, are they awake or are they not awake? And sometimes you're going to have to assume that they're going into a coma. And so stabilizing the airway and breathing is first. Second most important thing is circulation. And for circulation, it's the D in the DKA, dehydration, and we have to improve dehydration or fix the dehydration. Okay? They're acidotic. In the DKA is diabetic ketoacidosis. It's in the name. They have a ketoacidosis. So they have ketones. They're acidotic. So again, we're going to need, what does this trigger you? Blood gases. We have to look at their blood gases. All right. So potassium is the biggest issue here. I'm already looking in the DKA. But let's go back to type 1 diabetes. What do we need to understand and remember and review? The types of insulin. There's short-acting, there's long-acting, and then there's regular insulin. For emergency purposes, we use regular insulin. Okay? Know what types of insulin are regular insulins. Regular insulin. We have some developmental considerations here for diabetes in the sense that when they go home or when we're teaching them how to take care of themselves, if we're talking about school-age children, they can check their blood sugars. They can self-administer insulin. They can learn to count carbs. They are active and they can be active. They can learn to we can educate them on their diet. They can learn about their diet. In the beginning, the parents need to be extremely involved as they get through this and learn how to, because they're going to go to school. They're school-age kids. Remember this. They're going to school. They're not going to have their parent with them. They need to learn how to take care of themselves, and they know how and they want to. That's wonderful. They also need to recognize as a child, also, and as teachers and as parents, they all need to know signs and symptoms of hypoglycemia and hyperglycemia. Okay? And these kids also, we educate them on this because they're feeling it. They know when they have hypoglycemia and they know when they have hyperglycemia. But they have to be able to recognize signs and symptoms and what to deal with it, especially when they're going to be at school for hours. So they have these things. We have to teach them this. We have to know what signs of hypoglycemia we need to know as nurses so we can teach them, right? But when we're talking about illness, and illnesses can push a child into DKA in an instant, or an adult. into DKA. And also, as type 2 diabetics, illnesses can push type 2 diabetics into HHNS or HHS. So illnesses, sepsis, stress, surgeries, all can make the sugar go up, not down. It goes upwards. It goes into DKA. Also, hypoglycemia is dangerous for children because hypoglycemia is a sign. Think about it this way. Let's talk about patho. The brain, a child's brain needs sugar, carbohydrates, fats, proteins to grow. They do need sugar. And because they need sugar to grow, hypoglycemic events can cause the brain to stunt. Like small ones, small problems, slight hypoglycemia occasionally is not going to break a kid's brain. It's not. It could kill somebody, but repeated hypoglycemic events in the morning means that they're having hypoglycemic events while they're sleeping when we're trying to grow, and it doesn't let their brain grow well. So they can have, it can cause intellectual disability in another sense, in another disease. But we do not want to see hypoglycemia in the morning at all. So that's like one of the key things you have to understand about type 1 diabetes in pediatrics. Hypoglycemia is just as dangerous as hyperglycemia. They're both equally bad. We have to have the sugar balance, okay? School-age children should not be handling the sliding scale or dealing with their insulin and blood sugars when they're ill. The parents should be responsible for these things. They should be at home because they can easily go into DKA, right? But the other thing is we have morning glucose checks first thing in the morning. What is the adult parameter for sugar when you do a fasting glucose check? What are the numbers for a fasting glucose in an adult? Should they be around? Just to relate this back to pediatrics and type 1 diabetes, is the same numbers for type 1. So what if you're doing a fasting glucose check on an adult, what are the numbers you're going to expect? What is the range, I should say? What's your range? I'm only asking because it's extremely important to know. And it's also something I think you should know. Anybody know? Kareem, do you know what a fasting blood glucose should be? Thank you, Michael. Normal range is between 80 to 130 for a normal fasting blood glucose. Thank you. When we're talking hypoglycemia, we're talking lower than that. So if we're seeing hypoglycemic, if they're having in the morning their first glucose check in type 1 diabetes, this child is having anything under 80 is fine. Under 80, we have a problem. This is a concern because it can cause future problems. So it should not be happening. That means they should eat snacks before they go to bed. I'd rather have a higher sugar. So how about this? Hemoglobin A1C. what should be a normal range for what is the normal range for hemoglobin A1C? What's normal range? What's pre-diabetic range? What's diabetes range? You should know this. You guys should know this. Anastasia. Hemoglobin A1C ranges. Okay. 5 and below is normal. What else? What's pre-diabetic? Okay. 5.7 to 6.4, and then anything above 6.4 or over 6 is diabetes. Type 2 diabetes. Let me tell you, we do draw hemoglobin A1Cs on children. We do. But here's the but. We allow for a larger correction for hemoglobin A1C. We are okay with their hemoglobin. Now, remember, number one, we're not diagnosing them with type 2 diabetes when we're using hemoglobin A1C. The purpose of hemoglobin A1C for our diagnostic purposes here is to see the control of their diabetes. It's control of diabetes, and how well their control is, because it's reading the blood sugar buildup of in the red blood cells over a 3-month period, right? So once one is, even type 2 diabetes, once you're diagnosed with diabetes, we want to get the hemoglobin A1C down. It's not saying that you're not going to be type 2 diabetic, but you're in control of it, right? So if you at first have no medications for type 2 diabetes and it's up there at like 7 or 8, you're diabetic. And now we know that you're diabetic, you're on diabetes medications like metformin or Ozempic or Mounjaro, Tradjenta. There's all these medications. Then we try to, or glucophage. Then we tried to bring it under control. And so now the A1C is used not for diagnostic purposes, as in diagnosing you with diabetes type 2, you have it. We're using it as a control purpose. So are you under control? So with children, for control, you want it under 6 for control in an adult. In children, we allow for a higher number because we understand it's harder to control in children and that they need the sugar for their brain to grow. So, in all honesty, hemoglobin A1C is not like the end-all be-all number. We just want it under 7 or 8. Okay, that is fine. We just don't want it over 8. That is not good control. That's terrible control. And so they might be DKAing more often. That's not a good glycemic control. But we allow for a slightly higher number than a diabetic adult. Okay. Because of this developmental growth thing that's going on. All right. So adolescents with type 1 diabetes starts turning into a problem again. They've been diagnosed typically at school age, and their parents been helping with that, and parents don't give them more responsibility and accountability in their how to take care of themselves. But unfortunately, adolescents, as their brains change and they get older and peers are more important and all that's happening, they have a very increased risk for noncompliance because they have this extreme disturbed body image and they want to be like everybody else. And so they have this very increased risk for DKA. Extremely increased risk. They're moody, they're angsty, And so recommendation for adolescent control of their diabetes is to involve their peers, not their parents. And to have an adolescent have a friend that is involved with them in this, so they have peers that help them control this particular issue. It works so much better when they have a friend that has a similar app, the same app that they read for their sugar control, and their friends tell them that, oh, you need to take some insulin, or you need to eat more, or whatever it might be. Friends work here. This is about peers. Adolescent growth and development is about their friends, and so we incorporate that into their issues, because if not, I'm telling you, these adolescents come in with DKA more often than not, like way too often. Okay.
I think like 19 grams of carbs, but 17 grams of like soluble fiber. So a lot of fiber in
I'm
it.
just saying,
Sometimes
was there
like
anything
sugars,
else
carbs,
we
or
need
whatever,
to do?
or that means. So I was like, she has a lot of fiber in it.
Oh,
I've been
what are signs and symptoms of hypoglycemia?
I'm gonna have another one for breakfast and
Anybody remember off the top of their head what are actual signs and symptoms of hypoglycemia? Anybody remember? So they are dizzy, they're shaky, they have they're tachycardic, sometimes tachypnic. But also remember that hyperglycemia can also mimic hypoglycemia. So when you're reading test questions about a child with diabetes type 1, it'll literally start with a school age kid or an adolescent or a preschool kid or a whatever kindergartner or whatever age it is has type 1 diabetes, is presenting with dizziness, shakiness, they're diaphoretic, right? They're sweaty. You still don't know enough. If the question doesn't give you a blood sugar number, do not assume it's a one way or the other. It's probably trying to prompt you to get a blood sugar first. Like, what is it? If it does give you a number, then you know it's up or down, and you know they're going into a hypoglycemic event or a hyperglycemic event. Okay. What are some, if they're in a hypoglycemic event, if they are, what are some foods you can give that help with increasing blood sugar?
Are you just kind of thinking? Or?
They're going to ask these questions. What kind of food would you give to increase blood sugar? What are our recommendations here?
I know it's not ideal, but it's actually not too bad outside. Like, maybe walk around the block once or something, get fresh air, and just like
there are a few things.
Yeah. Because you're just being outside, like feeling the sun a little bit. The cold air would probably be nice too.
Anybody? If you have somebody that has hypoglycemia, what kind of food do you want to give them? What are your emergency foods? What should they always have on hand? Yes. Good. So easy sugar, orange juice, candy. I'm going to tell you they're going to try to be tricky and go pop. Okay, like soda. It has a lot of sugar. They're going to try and trick you and put peanut butter and crackers. peanut butter and crackers are something you give to stabilize blood sugar, and that is like before bedtime. Certain like snacks you can give them, but that's not for hypoglycemia. Hypoglycemia, you want like quick sugar, not long-term carbs. Okay, so don't get distracted by certain things. All right. Let's see. So I talked about a bunch of different things. These are like some of the bare bones stuff. Please make sure to know what some of these signs is, like hyperglycemia signs and symptoms, hypoglycemia signs and symptoms of DKA. Oh, at the bottom of this sheet, there are videos that you can watch that'll help you. A review on insulin, some more diabetes stuff, but also name that. Oh, there's a hypoglycemia YouTube video I have here, but also name that picture. So these are some endocrine issues you can try to match with your diseases. And there's a few here that's kind of fun to do. So you can do that on your own. I do have this picture here to help you along. But are there any questions on endocrine today? These are the major endocrine problems that we have. Took up a lot of time. So on Wednesday, we are dealing with cancer. So care of the child with cancer in general. Endocrine doesn't have something like in general to take care of, except for the removal of the tumor and stuff like that. It's has very like unique pieces of endocrine issues. But cancer, we're going to deal with ALL and Wilms tumor mainly, and care of the child with cancer like chemotherapy and being immunocompromised. So that's Wednesday. Otherwise, I'll see you guys, some of you tomorrow. We're going to have a great time. I do have some shadow experiences already set up.